to be going over bundles and offers today. I feel like we don't give this area enough credit with what we do, right? For you to sell or have anyone buy anything, you got to have a bundle, an offer, a package, something set up. And I know some of you are thinking, oh gosh, bundles and offers, does this mean I got to lower my price or I have to give discounts? No, it's quite the opposite. I wanted to put this session in because, in looking at sales numbers and looking at revenue growth, one thing that ties everything together is, do you have a bundle or an offer for specific services in your practice? And we see that most offices that are doing less than 7 figures, less than $500,000, they're just going a la carte, where they're like, okay, the patient needs this, let's do this. Or it's emergency dentistry. Oh, they need, a crown today, so we'll start on that today and we'll figure everything out later. They're not phasing things through with bundles or offers or packages. We know for you to do more treatment, to have more revenue, you got to bundle things together. So I want to brainstorm this through you. I want to kind of create a thought experiment on how we can actually think through bundling some of the most common procedures that we do in our office. And you'll see as we do this, you'll be like, okay, now I have something for Invisalign. I have something for crown and bridge. I have something for veneers. And I'm clear on what I can offer in each of these areas. Because sometimes we think, oh, we need to start marketing these things more effectively. We need to get in there and do better marketing. But the question always comes down to this. If some of your marketing is failing, think of this. Some of your marketing is failing or things are not happening where patients aren't accepting treatment, it always comes down to a few things. And let's just put the money thing aside. It always comes down to, okay, what is my way of presenting this treatment? Am I hitting those pain points? Am I connecting with those patients and making them feel understood? And if some of you are in our communications program, you know that making the patients feel understood, using the right word choices, language frameworks, communication sequences can make a big difference. But here's the thing. What that amounts to is literally just your copy, your messaging, right? That's really what it is. So if something is not selling, it's usually your messaging. And the second thing, which is what we're going to talk about today, is it's usually your offer. You don't have a strong enough offer in play. Now, this excludes all those patients that may come into your practice and they're like, oh, I make $1,000 a month and you're asking me for $5,000 today. I literally don't have that money today. Maybe I can get approved on, a financing plan, whatever it is. That's a different topic. But before you even go down that topic, you have to have this bundle or this offer. You got to have that squared away, because if you don't have an offer for what you're doing, or you don't have it in a bundle, then really what's happening is you don't have anything for them to buy, right? So the goal is, how can I package it up so they can buy something? And the thing that they're buying is more valuable now because it's in a bundle and there's an offer around it. And we know through, sales messaging and psychology, we know that the greatest offers have what baked into them? They have scarcity baked into them. They have urgency baked into them. And they have this whole psychology of, if I don't act now, there's going to be more pain than acting or leaving it for later. There's more pain to me today if I don't act now than if I just delay or procrastinate. Because we also know from sales psychology that people will do way more to avoid pain than they would to gain pleasure. We know that, right? So we kind of have to think through that from that frame. And as we go through bundles and offers, I want you to keep those things in mind, because that's like, oh, okay, I get it. We're keeping those things in mind because that's how I want to present the main treatments in my practice. So for you, it may be Invisalign. For you, it may be veneers, maybe crown and bridge. It may be you doing an ortho general bundle. So let's just think through it. If I'm presenting 6 veneers to a patient, what are they getting already? So they're getting, and let's just break it down. You and I are going to break it down by line items. But to the patients, we're going to create a bundle. So we know, and everyone in our office knows, we know if we're doing 6 veneers, they're going to get what? Well, some of you are saying the preps and the impressions and all that. Add the debridement. So let's just, if Emma says whitening, put it in the chat. I want it, and you'll see how we get granular about this, so that way we create value while we're doing this, okay? So the whole idea is to write down the obvious, and then we get granular so you see how offers are created. We do the same thing when we're selling anything online or to anyone. We're like, what is the offer? It's the same idea if you are going to take a friend to the movies and you're like, oh my God, go see the movies with me. It's going to be awesome. Let's go see this movie versus, hey, look, you're going to love this new movie that came out. Let's go check it out. We can have dinner before the movie. We'll check out the movie. And I know this cool coffee spot after the movie. We can grab some coffee after the movie. And then we can walk through this little promenade on the way out. So that's like a bundle or an offer for one event, right? It's the same thing with our veneers. So let's put it in the chat. So whitening, debridement, let's get granular. So now, if we're going to get granular with it, the first thing is this. With any 6-unit case, let's add in the diagnostic wax up. Could that be part of the package? Notice how I'm going to get granular, right? Let's add in the impressions of the pre-op, where we actually take an upper and lower, we have a pre-op, and we can actually talk through the case and smile design that case. Let's now add in the pre-cosmetic photos, right? Some of you are doing those, and if you're not doing those, you should be doing those because of A, from a marketing standpoint, B, from just a clinical accuracy standpoint, it's even better, right? So we're going to add in the pre-op, diagnostic. So let's just put that in there. Let's go diagnostic wax up. Wax up, and you can maybe discuss that with the patient. Let's say the second thing could be also, hey, we have that in there. Well, what if we add in now the cosmetic or the pre-op photography to smile design or case plan? So let's just call that smile design. Smile design pics. So we got 1, 2, 3. What else could we have? Notice these are things you're probably going to do, and if you're not going to do, you should be doing, but you're building value, right? So wax up. Why do we need a wax up, Dr. Ganatra? Well, here's the beautiful thing with your smile. We can actually see your outcome to a degree. It's not going to be exactly the same before we start. And I find that when we do that, our cases come out so much more accurately and patients' expectations are managed and we know where we're going to land. How is that rather than doing guesswork with your smile? Well, what about the pictures? Why do we need pictures? Well, pictures kind of help us show us where we start before we start. So that's why we want to take the pictures so that way when we finish, we can see the progress we've made. And that way, you'll take those occlusal shots, you'll take those shots from the profile, you'll take, all the different angles that you usually take when you do these cases. So add that in there as a value add because most practices may not be doing that. The one down the street may say, hey, you know what? I don't really need to do the pictures. Well, the reason why we do the pictures is because it helps our lab create a better outcome. It helps them get more clarity on the art. Now you're starting to talk about this from a standpoint of art, from a standpoint of not just, hey, it's 1 + 1 = 2. You're talking about this like from the standpoint of the process. Now the lab ceramist, the porcelain artist, she has to layer the porcelain. He has to make it translucent. Pictures help with that. We're including that in the package. Okay, we're including that in the package. The next thing we're doing is whitening. Maybe an occlusal guard. So let's put that in there. We got occlusal guard. Okay. Maybe we'll do an occlusal guard. Okay. And maybe we're doing a whitening. So now your patient's like, well, okay, why do I need the guard? Well, here's what we find. When you have new porcelain, new teeth on your existing teeth, we're literally changing the size and the shape of these 6 teeth. We find that it's going to feel cool, it's going to feel new, it's going to feel different. And if you're grinding it all in your sleep, or if you're contacting those teeth like the 6 to 8 hours that you're sleeping, we know that it could damage some of the porcelain, or you could wear some of the teeth below those teeth. So what we do is we actually give you this little guard, that it's a thin little guard, you can sleep in it, and it helps protect what we just did. It helps protect that. So now what you're doing is talking about, hey, this is the value add. It's helping protect that, right? And what about the whitening? Where does that come into play? Well, why do I need to whiten my teeth if I'm going to do the front 6? Well, here's the thing, and you know this. We're going to whiten before we do them, so that way we can get your teeth as white as we naturally can get them. So that way when the ceramist, the porcelain artist, makes those anterior teeth, they can actually now match the adjacent teeth. So even if you get your teeth whiter, or you whiten your teeth a year from now, your porcelain veneers are not going to change shade, but the rest of your teeth can whiten back to match the veneers, right? So we're doing all those things, and that's just the prep work, right? That's just the beforehand. Now you're building value with all these 3 things, and you're saying, hey, you know what? I get to do this, I get to do this, this. I'm building full value with this. How much is all this, doc? Well, typically for us to do the wax up, the smile design pictures, the occlusal guard, for us to get in there and to really just kind of whiten the teeth, to plan this whole thing out, we're looking at $1,500 to $2,000 a lot of times. I don't know what it is for your practice, right? The smile design, the workup, the wax up, that's what it could be. Oh, wow. Here's what we do. We know that the cases that we do can come out so much better, and we've seen the outcomes to our cases. So usually when you have 4 or more teeth or 6 more teeth that we're doing, we don't charge you separately for this. We put it all into one, and we include it with the price of your veneers. Oh, wow. So you're getting an additional $1,500 of services we're including with the price of your veneers. Like, oh, wow, that's great. Now, they may have gotten a consult from somewhere down the street, and they may have been told, yeah, I'll do your veneers for $1,000 less. Are they doing all of these things? Are they doing all this? And what's the value of all this? And you have to kind of think through this. And if you haven't been doing this in your practice, where you're like, oh, you know what? We just kind of do this. Sometimes the assistant whitens their teeth. Sometimes we take pictures. Maybe they don't need a guard always. This is stuff that we kind of figure out a la carte. If that's the case, then you got to ask yourself, can I make this stuff consistent with every treatment? Now I can use this as a bundle to package up into the one treatment. And my suggestion to you would be to have these things consistent. Because look, the smile design pics, you should be taking those. The wax up, it's a great preoperative visit with the patient. And the teeth whitening, most of you are already doing that. But most of you went straight to teeth whitening when, hey, there's an occlusal guard there. And I'm suggesting we bundle this in to the price of your veneers. The stuff that you're already doing, do you have a price point on that? Do you have a value point on those things? That is the most easiest way to bundle things together. And it's the same thing we do when we try to sell anything. We ask the question, and you all should be asking that same question. What can I do to make the core offer stronger? What can I do to make the core product stronger? So when it comes to veneers, we know that is, if I'm doing 6 veneers, I know I can make the core offer stronger if I did this, if I did this, and if I did this. This can make it even better. So me having a conversation on veneers with the patient, if I layer in the conversation on smile design, if I layer in the conversation about looking at your teeth before we start and designing it on a model together, if I layer those conversations in, the value of what I'm doing goes up. The value goes up, the price points rise, right? Now patients see justification in you and them paying what you are asking, right? So that's what I'm asking. Same thing with any offer. What are we normally doing? What do we normally do? What do we normally do that we're not talking about? What are the things are we doing that adds value to the core product or service? That's the question. Does that make sense so far? Right now in your mind, you should be thinking, okay, with these cases, I kind of do this, but I don't really talk about it with my patients. We just kind of do it. Because for you, sticking them in the chair, the assistant doing the whitening, while you're working over here on the prep or another case, it's not a big deal for you because you've been doing this for decades. But the big deal is in being a better curator and a better craftsman or woman of the offer.